Principles of tests and measurements. Do you want to master the process of assessing a patient? First, you need to know the basic principles and concepts. So stay tuned and keep watching this video. Hi everyone, this is boy Lil Z and welcome to a new learning series about physical therapy evaluation. But before anything else, if this is the first time you are watching my video, hit the subscribe button and the bell icon to support my channel and to be updated for my upcoming videos. Also give a like, comment, and share this video to everyone at home. And in this video, I want to share with you 3 main points about the principles of patient history. Number 1, introduction of patient history. You see, as physical therapy, thorough assessment or evaluation are very important to master. Musculoskeletal assessment on one hand requires a thorough examination on a patient, and thorough systematic examination is having a detailed step-by-step process of examination to the patient. You see, proper and complete assessment is the key ingredient in having an accurate diagnosis. And the most commonly used assessment technique is the problem-oriented technique, or what we call as the SOAP node. S for subjective, O for objective, A for assessment, and P for plan of care. Number 2, patient history or subjective part. Patient history contains the patient's history of condition until present, and it falls in the subjective part of SOAP node. However, in order to achieve a complete assessment or a complete subjective part and patient history, the examiner needs to have a good rapport and a good questioning skills. These two will now allow the patient to be more open to the examiner in explaining about his or her condition. In addition, the examiner should also take note of the possible red flag signs or yellow flag signs. Red flag signs indicate the problem is not a musculoskeletal one, or it may mean that it is more serious problem that should be referred to appropriate healthcare professional. While yellow flag signs may indicate problems that needs extensive examination, cautions, or problems that may involve more than one area. In taking patient history, here we have 25 subjective questions that you may ask to your patient in order to have a complete subjective part. Number 1, what is the patient's age and gender? You see, many conditions occur on specific age range, and also some condition specific on what gender, or it is more common to a specific gender. Number 2, what is the patient's occupation? Of course, different work, different environment may have different impacts to the patient's body, to the patient's condition. For example, the patient is a porter. They may have strong bodies, however, without education, without the proper body mechanics, muscle strain and back pains are very common to their area of work. Number 3, why has the patient come for help? This question will allow the patient to describe in his or her own words the reason why the patient is seeking for PT service, and also what is the primary problem that is bothering the patient functionally. Number 4, was there any inciting trauma or repetitive activity? This question will explain how the condition started and was there any factors that may contribute to the condition. Inciting trauma is also called as macro trauma, where it is an event that have big impact on the patient's condition. Repetitive activity trauma, on the other hand, is also called as micro trauma, where it is a series of events that have small impacts to the patient condition, but in the long run, it will have a big impact. Number 5, was the onset of the problem sudden or slow? This question may help in making a differential diagnosis. Number 6, where are the symptoms that bother the patient the most? This question may lead the patient in pointing to a specific structure or a more general area, which may indicate a yellow flag sign. Number 7, where was the pain or other symptoms when the patient first had the complaint? Pain may be subjective and is unique to each individual, and pain may be divided into 2 acute pain, which is a more disabling, continuous, and often severe one, and chronic pain, which is a more aggravating and not as intense as the acute. This question, on the other hand, may answer the question if the pain is localized or whether it is radiating. However, also be careful with what we call as the referred pain. Number 8. What are the movements or activities that causes pain? At this point, this question may help the examiner in differentiating whether the patient is having mechanical pain or systemic pain. Number 9. How long has the problem existed? Again, this question is simple and it may answer the question whether it is acute, subacute, or chronic. Number 10. Has the condition occurred before? This question will determine the location and severity of the injury or condition. Number 11. Has there been another injury to another part of the kinetic chain? You see, some condition may affect only one part, but some other conditions may also affect the other body parts that have the same kinetic chain. Number 12. Are the intensity or duration of pain or other symptoms increasing? This question will tell the examiner if the patient's condition is improving or worsening. Number 13. Is the pain constant, periodic, episodic, or occasional? Constant pain means that the pain is always present even when its intensity varying, and it may suggest the presence of tumors, chemical irritation, and possibly visceral lesions. Periodic or occasional pain is more likely mechanical and is related to movement and stress. And episodic pain is related to specific activities. Number 14. Is the pain associated with rest or activity? This question may help the examiner in also ruling out other conditions and making differential diagnosis. Number 15. What type or what quality of pain is established? You see, different body structure may have its own type of pain. For muscles, joint capsules, and ligaments, these three has similar type of pain, which is dull, aching pain. For vascular or the blood vessels, the type of pain is throbbing. For nerve root, it is sharp shooting pain. For sympathetic nerve, it is burning pain. And for bony structure, it may be deep and nagging pain. Number 16. What type of sensation does the patient feel? Or where are these abnormal sensations felt? Again, some condition may have different type of pain, and other condition may have pain that are moving around your body, or what we call as the radiating pain. Number 17. Does a joint appear locking or unlocking or unstable? Locking may mean that the joint cannot be put through a full range of motion. Giving away may be caused by muscle weakness, that the patient may feel that the limb will buckle when weight is placed. Instability may be divided into two: anatomical, which refers to excessive physiological movement in a joint because of subluxation or dislocation, while the other is functional, that implies an inability to contract either arthrokinematic or osteokinematic movement. Number 18. Has the patient felt any bilateral spinal cord symptoms? You see, dizziness, vertigo, loss of balance, and fainting may say that the patient's condition is neurological or it affects the upper motor neuron. Number 19. Are there any changes on the patient's color of limb? This question may answer if the patient has systemic problems, and it may point out to the specific organ affected. Number 20. Has the patient experienced any life or economic stresses? You see, this question may answer whether the patient also has psychological problems, and it may lead to yellow flag signs. Number 21. Does the patient has any chronic systemic illness or adverse or any bad social habits? This question may also answer whether the social habits has an effect on the patient's current condition. Number 22. Is there any family-related health history? This question may answer whether the patient's condition are inherited from his or her parents. Number 23. Has the patient undergone any X-ray, MRI, or CT scan imaging techniques? You see, these imaging techniques may help the examiner in coming up with an accurate diagnosis. Number 24. Has the patient received any medications, steroids, and how long? You see, medications may have side effects on the patient's condition, and also it may have a good effect, however a bad effect when the patient is having physical therapy treatment. Thus, knowing the medication taken may also help the examiner in making the time or the schedule of the patient's treatment. And number 25, does the patient have a history of surgery or history of present illness? For this question, make sure to include the date of surgery, what condition it was, and where it resolved or unresolved. And number 3, categorization of questions. In this video, we've talked about the patient history, or what we call as the subjective part. Thus, I will be grouping this question into the specific subpart of the subjective part so that it will be easier for you to learn. And as we all know, subjective part has 13 subparts. First, for the chief complaint, here lies the question numbers 3, 7, 8, and 15. Next is history of present illness for questions 4 to 19, 23, and 24. Patient's goal is for question number 3, prior and current level of functions for questions 6, 8, 11, and 15, social health habits for number 20 and 21, living environment for questions 14 and 18, employment status is for question number 2, general health status for question number 9, 11 to 15, family health history for question 22, medical or surgical history for number 21 and 25, medications for question number 24, and other ancillary procedures for question number 23. That's it for this video. In this video, we've learned a lot about the patient history, or what we call as the subjective part. We also group it into different subparts of the subjective part. So I hope you've learned a lot from this video. Again, if this is the first time you're watching my video, hit the subscribe button and the bell icon to support my channel. Also give a like, comment, and share this video to everyone at home. So God bless you all. See you soon on my upcoming videos. This is boy Lil Z. Peace out.
Run.